This is 9-year-old Lovisa. She lives in one of the most vulnerable communities in Namibia. Life is hard for children in this country. As a country with the second largest income gap between rich and poor in the world, 1 in 5 people living below the poverty line. Even though much has been done since independence in 1990, still, 1 in 2 children in rural Namibia are born into poverty. Many die at birth. A large number miss life-saving vaccinations, and not all are registered when they are born. This in turn affects the much-needed social services they receive. As an upper-middle income country with a stable government, you would think Lovisa has every chance at succeeding in life. But being born into a poor rural family will make it difficult to achieve her dream of becoming a social worker. She has witnessed physical violence against her brother, watched an uncle die of HIV/AIDS, and an older sister give birth in her teenage years. Attending school for Lovisa is a daily fight. She struggles to keep up with her classmates who attended early childhood development (ECD) programs, and many times she goes to school without breakfast. 84% of Namibian children do not attend ECD programs, and 95% do not attend pre-primary school, making them less prepared for formal education. Many of these children will never reach secondary school. What's more, the country is facing the effects of climate change, including drought and periodic flooding, disease and food shortages, affecting thousands of children across the country every day. For many years, UNICEF has been working alongside the government to ensure the rights of Lovisa and every child are being met. Things are getting better, but there's still much to be done. Looking back at our previous country program, we learned that the main stumbling blocks holding children back was not the issue of too little spending, but rather it was ineffective spending. This, together with limited technical expertise, resulted in weak outcomes for children and the wider community. We've realized we need to shift our emphasis from developing policies and legislations to addressing bottlenecks preventing these policies from making a difference. Moving forward, ensuring that all children, wherever they are, have access to quality services through an integrated, rights-based approach, drawing on the resources of government and our development partners, and building on best practices from other parts of the world. We also need to empower communities to demand for the services they need. Our new country program for 2019 to 2023 focuses on 4 key areas that will help to address these gaps. Child survival and development will ensure that Lovisa and all Namibian children from the age of 0 to 10 have improved access to healthcare, education, child protection, early childhood development, civil registration, and water, sanitation and hygiene services. We'll achieve this by training civil servants, police, magistrates, prosecutors, and social workers, and by improving access to ECD programs, pre-primary and primary schools, especially for children from marginalized, poor and remote areas. This will ensure Lovisa has the best start to life, so she can be healthier and better equipped to cope with secondary school and further studies that could shape her future. As she enters her teenage years, our focus on adolescent development and participation will serve as a platform where her voice can be heard, ensuring she receives better education, health services, and HIV treatment if needed. By improving child-friendly environments, Lovisa will have better access to social protection benefits to reduce poverty. Drawing this all together, our focus on program effectiveness will ensure that government regularly reports on how the rights of Lovisa and all children and adolescents are being met, overcoming harmful social norms and practices in the process. Every step of the way, we will monitor and evaluate the program to identify and address risks, making sure Lovisa is given the chance to thrive at school and at home. Working together, we can help Lovisa and all other children in Namibia to fulfill their dreams and create a better future for themselves, their children, and the country.